Good morning, everybody. This is Dr. Jeff Culbert coming to you from Schooley's Mountain Chiropractic Center in another wonderfully wet weekend in Hackettstown, New Jersey. So I know we've over the last 3 years have grown the channel so that it's reaching people all over the world. Wherever you are watching this video from, if you've got a little bit of sunshine, I would really appreciate you sending some our way for a very selfish reason. This is my second daughter's 36th birthday today. We're planning an outdoor event for her at her house, so a little sunshine would be appreciated. But with that being said, welcome to our channel today again. For everybody who's out there that is seeing this for the first time, if you would love to hit like, subscribe, and the little bell so that you know when we're releasing videos in the future, that would be great and greatly appreciated to help us grow our channel. Today, we are going to do a patient interview and go into adjusting this patient. Patient's name is Wayne, and he's been a patient here now probably for about, I'm going to say four, maybe
About
5 months
4 months.
on the outside.
Yeah.
And he comes to us with a very varied background in terms of his health condition and things that are going on with him. And I thought it would be a great idea to interview Wayne, because as Wayne unfolds some of his history and what's going on with him that present some unusual challenges in treating a patient, I thought it would be good to get his perspective on care in our office since he's been here, because there would be a lot of MDs who would probably say Wayne should not be seeing a chiropractor. But the thing is, in our practice, we practice in a number of different manners. We approach somebody with the Goldilocks theory of care. We never want to be too aggressive. We never want to be too gentle. We want to try to find, with the techniques that we utilize in the office, what is just right for that particular patient. So as Wayne unfolds his history a little bit for us in a couple of moments, you would sit there and maybe say, how is it possible to adjust him with some of the things that are going on? Well, again, we may not be utilizing traditional diversified adjustment everywhere with Wayne because it's just not possible to do it. But we still can make a positive impact on the nervous system by adjusting with a gentler technique, knowing that it may take a little bit longer, but ultimately the goal is not to go boom, because that might hurt him and then complicate his condition even more, but to get his spine moving in the right direction with the complicating factors that are there that will, one, first start to provide him some relief, and then start to make some things stabilized so that he can have more relief longer periods of time. So with all of that being said, let me introduce Wayne. And Wayne, say hello to everybody and give us a little background about your condition and how you found us.
Right, so I found Dr. Jeff. It was at a wedding in February. No, January. It was January of this year. And the father of the bride said, well, how you doing? I said, well, I'm still worse than after my surgery. He said, oh, you got to go see Dr. Jeff. I had complications years ago. Let's go back, like in 1980, I went to a chiropractor after a car accident and it hurt me. And I never went back to a chiropractor after. So that being said, he said, give Jeff a try. I said, well, I'll think about it. Well, that same week, I had seen a neurologist. Now, I saw a neurologist because 6 months previous, I went to a neurosurgeon. And that neurosurgeon did cervical fusion. So my neck is completely fused now. It was 4 or 5 months when I came to Dr. Jeff. And the neurologist said, well, whatever's going on, it's, nothing we can figure out systemically, but, maybe some medicine will help. And at that point, it just happened to be the same weekend I went to this wedding. And I said, I got nothing to lose. I'm going to go see this guy. And so I came to Dr. Jeff in January with nothing to lose. I had already seen 2 neurosurgeons, orthopedists. I've had injections, fusions, physical therapy, ad nausea, 2 different neurology groups, a couple of shots in my spine, and I still was limping around. Right, so came in with the idea this isn't really going to do anything. We had a long discussion. I think I gave Dr. Jeff a box of DVDs for all my radiological
I think we
testing
had,
done in the last
there is
12
at least
months.
a dozen, if not
I think
18.
I
There was
think
a
50,
lot.
yeah, there was a lot, like 15 of them. And he just went, can I take those on the weekend? I said, yeah, sure. You can just, I'll give them back, next week. So went through a long history, which is very long. I had a car accident in 1978, broke my neck. Never really got treated for the neck as much as wearing just a brace, but because of the injuries, I had a complete foot fusion of my right foot, followed the following year by complete fusion of my right ankle. So for 40 years, I've had one leg longer than the other, and I've limped for 40 years. Make things worse, I had a bone tumor in my left arm, so I have no left elbow. I need a shoulder replacement. So I have a lot of things going on. My neck was stiff probably since 1980 because of the accident, and it really never bothered me. But after my low back pain and seeing all these specialists, they determined all my problems were coming from my neck, and that if I did not have surgery, I'd be paralyzed if I missed a step or I had a fender bender. So because of the fear, I did have the surgery. So I had the surgery. Surgery was successful. However, my pain was 10 times more than prior to surgery. Then we had different medications. They didn't help. Physical therapy didn't help. We had a couple of lumbar injections. They didn't help. Came here, did the history, did some minor adjustments. But I will tell you that I left here after my first visit, walked to my car, and the pain that when my left heel hit the ground in my lower spine was completely gone. I was pretty amazed. And now I was coming 3 times a week, twice a week. Now we come once a week. And it does keep that area of my problems free and clear. I'm doing more now than I could do before. I have other things that we're trying to fix, which is I have burning numbness throughout my body. It comes from here all the way down, more on my left side than the right. And we're working on that. I recently had 2 injections by pain management on my left side, which put me backwards again another 10x. So I'm done with any type of injections. I don't want any more medicine, which one of them almost put me in the hospital. And we're going to stick to some manipulations, adjustments, and some of the exercises that Dr. Jeff and his team have given me over the last several months. They're all very light exercises, but they definitely make me feel better. And that's where we are now. We're at that point where I'm still looking for other things to fix me, which we may not be able to do here. So I still have appointments with other specialists. I want a rheumatology, make sure I don't have anything, Lyme disease that is not being diagnosed by conventional labs. On Monday, actually, I'm doing that. And then I have another neurology appointment with a different group in a couple of weeks because I've had multiple new MRIs and X-rays and new blood work for them to look at also, just to see if there's anything systemic going on that's being missed. And that's where we are today. And I thank Dr. Jeff and his crew to get me back. I was out actually fly fishing a couple of weeks ago before I had these 2 injections. I was doing much better. Now I don't think I can get back in the river for a while, but we'll see what happens. But yeah.
So, as you can see, that's Wayne's story. And if some of you out there have similar things that are going on, and you're at a point of, what do I do? Hopefully, Wayne's journey to our office and his journey in our office will help to let you seek help from alternative sources. And I think Wayne and I have had enough conversation to know that with the things that are there, he needs a team approach. Okay, and we've discussed this.
All right.
So I am just one part now of his healthcare team. I'm alternative based. And again, as he is going through this journey, working with the neurologist, working with the medical doctors, the rheumatologists, and getting the medical side of the approach, now it opens up a dialogue for Wayne and I, because at one point in time, especially early on when Wayne was here. And again, during his initial exam, we were discussing his case, and I was asking about, were there any upper motor neuron symptoms that were there with him? Because again, the MDs and the neurologists were painting a picture of the absolute worst case scenario. And as Wayne stated, instilling fear to move him into a procedure that, unfortunately, as Wayne just let you know, made his condition worse and was one of the reasons to prompt him to come to see me, basically as a last resort.
Last resort.
Got
Yeah.
nothing to
You got
lose, so
nothing
might
to
as well go
lose.
see this
That's it.
guy.
You got nothing to
Okay,
lose. I'll give it a shot.
what else can he do? But the bottom line is, I asked him about the question, were there any upper motor neuron symptoms, any hyperreflexia, okay, going along with that when reflexes were taken, and none were there. And with none of that upper motor neuron stuff there, and then gleaning through all of the MRIs that he brought in, it was my feeling that there was enough of a gap between what was there arthritically and with the discs that he was not experiencing any major cord compression, and that he might have been able to do okay avoiding the surgery. But six half dozen or the other, hindsight is always maybe 2020, and you got to go with what you got based on the information that you have at the time. So for Wayne, okay, he made the decision for surgery. And I do believe that with his neck and what's going on with the lower back, that there is a connection by way of what is known as love-it brother relationships. And you have to understand the concept of every part of your body is connected with another part that may be affected by something else going on in the body. So if we look at it from a chiropractic standpoint, your skull is connected to your pelvis, the neck is connected to your lower back, upper middle back, lower middle back, left hip, right shoulder, left knee, right elbow, and so on. So there's all these little connecting points. And off of the kidney acupuncture system, the psoas muscle, that primary bend and twist muscle of the lower back, connect into the hip, lift your leg, turn and twist the torso, attaches to bone and to disc. The psoas muscle has an intricate play with the upper trap muscles that support and stabilize and move the cervical spine. And then if you count down the vertebra and count up the vertebra from the lower back and from the neck, there is a connecting point with Wayne and what was done surgically and what goes on down in his lower back. So I can make a point that he's got numbness coming from here down and burning. This region generally is supplied by the cervical spine. Knowing that there's the connection between that 3, 4, and 5 region in the neck with the 2, 3, and 4 region in the lower back, and the psoas muscle being weak, and the stuff that goes on down his leg, I can make the connection between the two. Now, I cannot go in and aggressively adjust his cervical spine with a diversified adjustment because, quite frankly, it's fused. It's never going to go. But we can traction, we can work acupressure points, we can use the activator, we can do some gentle flexion into the neck to just instill a little bit of mobility. And a lot of times, working the way we can with the neck will help Wayne with his lower back. Had an incident where the lower back was flared up. We aggressively beat up the neck, and Wayne comes in the next time and he goes, "What did you do?" Because all of a sudden my lower back is feeling better. But it was paying the extra attention to the cervical spine to the degree that we could do it. Now, the fact that Wayne also has a fused ankle and a fused foot means we do have biomechanical faults and differences that present what is known as limitation to tissue. And chiropractic works on 33 different principles. And one of those is that there is no process which does not require time. So the goaling for Wayne has to look at a number of factors. One, there's disc degeneration going on in both what was the cervical spine before the fusion. There's stuff going on in the lower back with arthritis and stenosis and disc. He has an elbow that is essentially fused and is going to present mechanical faults that are going to influence what's going on in the thoracic spine and the cervical spine. The limitation with the motion and the limping, which presents problems mechanically into the lower back. So we have to understand that there's limitation to tissue, and our goal is to provide Wayne the best relief we can with the circumstances that we have to work with, and try to work to support and stabilize that in a team fashion, where I may not always agree with what the MDs and the neurologists are saying, but it's a team approach. And I do know that there was a study done in 2015, 2016, which concluded every single medical procedure ultimately does better with chiropractic care, not necessarily because of the adjustment, although balancing the nervous system is key, but the lifestyle that goes along with that, with the proper exercise, the proper diet, the proper rest and recuperation, watching your posture, maintaining a great attitude, consistency and regularity of care, all work to help Wayne create the stability to the structure that needs to be there, that if it was just left to the surgery or to the injections and to the medications, may not have the same type of quality of effect. Now, we're still trying to put our heads together and knock wood as to why these procedures that should be giving him relief actually aggravate and augment the symptoms.
Correct.
And sometimes for 2 to 3 to 4 weeks before we start to get them calmed down and moving in the right direction. So during this time frame, Wayne, where we have these little setbacks, because inevitably every patient will have experiences
Right.
and setback. Hopefully not to the degree that you experience, but it might be helpful to explain to people that are out there listening, when something like that occurs, how do you wrap your, I know you're frustrated, but how do you wrap your head around it to try to stay as positive as you can and keep moving in that direction, that it does not stop you from living and enjoying life?
Well, the first thing is, I got a clearance, so to speak, from the MDs, right? So I've been to neurology, neurosurgeons, pain management, orthopedic, and they've looked at, I think we have 15 MRIs, something like that. And no matter what I do, they say at this point, because of the surgery, I can't hurt myself doing anything. So the pains that I have, I just keep going. I work through. I drink a lot of water, as I've been pushed to do, but so I drink a lot of water. I take no medications now as far as for pain or any of that. I do take a lot of supplements now, and I eat right, and I continue to move. I move as much as I can, put it that way. I mean, I'll do more than I should, but I push myself because I can't hurt myself. So my theory on that is you have to relearn these nerves, and these muscles are going to have to listen to what I say. That's how I think about it, because right now the muscles aren't doing anything because the nerves are on fire. So I have to push through that and make them do what they have to do. And with the adjustments that I'm getting here and the treatments that I'm getting here and the exercises that you gave me, it actually does get me to the next step. Yesterday I did a little bit of work around the house for about an hour, and this whole side it feels like, if anybody had, I'm sure everybody has had, their foot fall asleep and they get up and they shake it off, and for that 30, 40, 50 seconds, it's painful. Well, that's how I am from here down. And then when I do too much, it gets to the, what they say, 1 out of 10, it's a 10. And I have to sit down and just take it easy the rest of the day. And once I lay down and get up in the morning, I can start it all over again. But that's what you have to do. If you sit back and do nothing, your body's just going to deteriorate and you're going to become nothing and you won't be able to move. So you have to really, and I read a lot. I mean, reading if you read enough and you really get into a book, it does take you out of your zone and you forget about the pains that you're having. You need to do something to get your mind off of pain. That's what I would prescribe. If people just focus on their pain, these are the people who never get out of bed. These people become nothing. They're taking their pain meds. They're going to the pain doctor. They're signing up for disability at age 40 and never working again. You can get over this. You can push yourself. You may not be back to normal, but your new normal is livable. That's about what I can say about that.
And that is absolutely perfect and beautiful advice. One of the things that we talked about it when you first came in, especially during your report of findings, is the key is to keep you as mobile as you can be, And it's mobility that is monitored by the patient to say, am I going to the point of too far with what I'm trying to do?
Right.
Because we work on the principle here that we tell people to rest. And everybody thinks rest is, well, I get to sit back in the chair and kick back and lay down. I can watch some Netflix or, watch a movie. And that's not what rest stands for. We use rest as a mnemonic that basically stands for resume your exercise, RE, below the soreness threshold. There's the ST. So if you can resume activity that is below your soreness threshold, and you can get through that activity and there's no pain or discomfort for an hour, 2 or 3 afterwards, you found a safe level of activity that promotes mobility within the body. The body heals faster when it is mobile versus when it is immobile. Okay, basically, if it's immobile, it's like a car sitting in your driveway never being used. Eventually, it rusts and falls apart, and then everything deteriorates, and oils leak out, and the gas gets bad, and you can't run the car. So Wayne is right. You eventually become decrepit because your body deconditions, and as little as 2 weeks of not doing things, your body loses half of its ability that it had prior to. Now, muscle memory is a great thing, and thank God God gave us it because we can respond very quickly and come back. But the key is to stay as mobile as you can and monitor your body. Now, the thing that I find that most people avoid, Wayne, is that, well, I'm mobile. You told me to be mobile.
Right.
Well, I'm hurting like hell.
Yeah.
I also told you not to do that.
Right.
Okay, it's like when it starts to hurt, you got to stop. But a lot of people want to just keep going to get the activity done and over with versus breaking it down into snippets. One of the things that we talk about, and I don't know if I've spoken to you about it yet, but sooner or later we'll get to it because it's been a constant theme in the office over the last few months when I was working out. Most everybody knows who watches. When I work out, I just turn on YouTube, so I got something in the background.
Right.
When I'm on the treadmill, it gives me something to look at versus just looking at the thing go around the track. And when I'm lifting, I have something that I can keep my eyes and ears on to get information into my head. And one of the things that we listened to was a training method that the ancient Spartans used to do. And this is an amazing little concept, and it works so beautifully for me to educate patients on. It's working in what the ancient Spartans called pomodoros. And a pomodoro is that you do something for 25 minutes, and then you take a 5-minute break. And after that 5-minute break, you resume activity for another 25 minutes, take another 5-minute break, resume for a third set of 25 minutes, followed by a 30-minute break. Now, if this is advice that's good enough for ancient Spartans, who at the time were the kick-ass people of the world,
Right.
Okay, I think that we in our modern age should maybe learn something from ancient Sparta that says, do something and then take the time to check in with yourself. Take a break. As Wayne said, he drinks a voluminous amount of water now.
Right.
Take some water in. Wayne and I are both older gentlemen. Sometimes you got to go pee. Okay, so lots of water just to, even if you just sat down and did some basic back stretches or upper back or shoulder stretches, neck mobility stuff, just to give yourself a little break from the activity and then resume it. But it's monitoring. Am I hurting during the activity? I'm not ready for it. I should stop, ice, and break for the day on that. There's no pain after initiating it for, say, 25 minutes like the Spartans did. I'm feeling okay after 5 minutes. I'm ready to go back and try another 25 minutes. We get through the activity, but you start getting achy within that hour to 3 hours. It wasn't a quick hit of inflammation, but it was more like a slow burn waiting for the dynamite to explode and then create it. So when that occurs and the discomfort comes on later, then we ask you to think about what you did and then how can you modify your duration or intensity. So you can still be mobile, but maybe not as hard as you had been or as long as you had been. So the perfect example I use, if somebody's on the treadmill, instead of going at a 3% grade for 4, 5, 6 miles an hour, at 30 minutes, maybe drop it down to a 1% grade, go at 3 miles an hour, and
Right.
maybe do it for 20 minutes and see how you feel with that. And what we're trying to do is create, where can you establish what your normal is? And then, I don't know, you read a lot.
Right.
Okay, I don't know if you ever heard of a gentleman by the name of George Leonard. I had a seminar with him
Right.
back in 1999. So this is 26, 27 years ago. He was an 84-year-old Aikido master. If you looked at this gentleman with his white hair and his thin, frail body, you would sit there, I could blow on him and knock him over. The guy was incredibly strong,
Right.
flexible, and reflexes as fast as lightning. It was unbelievable to watch this guy go through his stuff.
Right.
But one of the concepts that he taught us was that as you're progressing through life,
Right.
it is often helpful to live on a plateau. Okay, and that plateau is a certain level of activity that you're able to do very, very comfortably. It's your normal.
Right.
And then at some point in time, it's time to step up and create a new normal. To go from normal to the new normal, unfortunately, sometimes is uncomfortable.
Right.
Okay, but has to eventually get done, because if you live on the plateau too long, there's no forward progress, there's no growth, there's no development. So at some point in time, you've got to say, when can I step up to a new normal? So if your new normal is taking it, okay, instead of 5 miles an hour like I used to do, I'm doing 4 now.
Right.
And I'm doing a 2% grade, and I'm doing it for 35 minutes. Your next new normal challenge might be, can I take that same level and go from 35 to 40 or 45 minutes? Can I move it from 3 miles an hour to 3.2? Now, it's not a big jump,
Right.
but it is creating your next new normal. And one of the things that people will often say is, Doc, you're in incredible shape. You're amazingly fit. Yes, I am. But if you saw me at 49, okay, you might not say that. Okay. But through patience and perseverance and constantly saying, this is my new normal, I'm waiting, now's my new normal, that's my new normal, here's my new normal. So when people see me now at 65, and there's people who have lived with me during this whole journey when I was 49, and it's amazing to see what the body can do,
Right.
given enough time and enough patience, because sixth principle of chiropractic says, there are no unrealistic goals, only unrealistic time frame. Everything is a process, and all processes take time.
Right.
You know the great line from My Cousin Vinny, right?
Yeah.
Okay, it takes 20 minutes to make grits. You can't do it in 5 minutes. Some of the things that Wayne has, we have to remember that it is a process. It's 20 minutes to make grits. And I know Wayne would love to have 5-minute grits.
Yeah, but they wouldn't taste right.
But it's not going to taste very good, and it's not going to really do what you want it to do. 4 to 6 weeks ago,
Right.
you made a comment to me in the practice.
Right.
Do you remember what that was?
No.
Okay. And this is going to be a little bit on Wayne's journey. Wayne came in, and it was one of those periods of time. It was in between medical procedures, and he was feeling really, really, really good. And his comment to me was, had I found you sooner, I probably would not have needed and gotten the surgery.
Correct.
Okay. Explain to everybody how you came to that conclusion, so that they can say, maybe there's hope,
Right. Well,
that chiropractic might be a key for me to be able to say, regular or traditional medicine is not going to be the answer. Maybe I should consider something that's alternative based.
right. You have to go back again. All right. So we have to go back real quick. So my low back pain, which started all this, was November 23. Right. November 2023. I decided I should move an elliptical machine in my basement 5 feet to the left. It's a 280-pound machine.
By yourself?
By myself. I got it all the way over to the side, but at that last push, I found myself on the floor head first. Right? And it was Thanksgiving weekend. I didn't want to bother anybody. So I did some heat treatments, Advil, the usual Tylenol. And on Monday, I contacted my primary care. Went right in. I got an MRI the next day. I got x-rays the next day. Everything was good. So I went to physical therapy, was put on steroids, and in 3 days I felt wonderful. So from there, we go 3 months down the road, pain came back, went to more physical therapy, more steroids. 3 months later, some pain came back, and the pain was always here. Right? Well, that pain came, and then all of a sudden I had this burning sensation. So I went back to the doctor, new MRIs, everything's normal, sent me to neurology, had a bunch more testing, more MRIs, moved them straight up. And of course, they saw my neck, which we talked about. I had a car accident in 1978. My neck has always been bad, and was told I'm going to be paralyzed. If I didn't get a surgery, I'd be paralyzed with just missing a step. So I ended up having this surgery. Pain didn't go away. Pain down here was now worse than it was before, and the burning was further up. So 4 months go by. I get the brace off my neck. Bone stimulator's gone. I still have the same pain, except it's worse in my lower back. Then I got shots. They sent me to pain management, more physical therapy, a couple of spinal injections, different medications that didn't do anything. And came in here after all that time, did an adjustment. I think we did I can't remember if it was
Cold laser?
cold laser on the first day. And I said before, I walked outside and the original pain from 2 years before was gone. Meantime, all this other stuff, all these MRIs and injections and medicine and physical therapy and surgery did nothing to help that pain. And yet one treatment, first day, the pain went away. So in my mind, why did I even have this neck surgery? The neck surgery to me was looking at an MRI, and the MRI looked bad. We got to fix the MRI. But I don't think it was fixing me. I think it was fixing the MRI to make it look anatomically perfect on an MRI, which it does now. I had a new MRI. It looks great. Except all my symptoms are worse than they were before surgery. And the best part is the pain part of my lower back is not nearly what it was before. The burning and the numbness and the tingle is much worse, but the pain is gone. So if I came here first, it would have got rid of the pain, I'm thinking, and I would never had all these other problems. I may have had a little burning and tingling because my neck was bad, but not enough to run out and have it fused. And now it's stuck where I am that no one knows what to do at this point. So yeah, I think if I came here, I don't think I would ever have to get any of those things done. Maybe one more MRI, maybe to make somebody happy. But yeah,
When things look bad and the MD's painting the worst possible scenario, it's generally helpful to get multiple opinions, but sometimes get the opinion of an alternative practitioner. And the key is, Wayne came to our office based on the recommendation of family friend, okay? And again, these guys are patients in the office. And I've been taking care of that family, my gosh, since I practically opened my doors here in 1992 when I came up here. So they had the confidence and belief in me because if you listen to Wayne's story, you go, really complicated. Well, the kids had their own unique stuff going on.
right.
Okay, the older daughter and the younger daughter especially. And again, it was one of those things. We created a team approach, worked with nutritionists, we worked with medical doctors, physical therapists. They continued with their chiropractic care. So they know that in our office, we do live by a motto: get people well and take care of them with a lifetime of care and service, and always be able to try to guide them in the right direction. Wayne's story, again, when he came in and I looked at his stuff and asked him a couple of questions about neurologics, and those weren't there. It was my conclusion that, again, as Wayne said, if I had come here first, he may not have needed the surgery. And without the neurologics, okay, that would have been my first key. Had any of the neurologics been there, it would have been my first recommendation. Let's get into an orthopedic surgeon, neurosurgeon, because you've got neurologics that mean we have to explore and possibly fix something more than what I can do in the office. And trust me when I tell you, I've seen these guys come in with clonus and hyperreflexia and the whole 9 yards in the shuffling gait. And you try to get them out to the orthopedist as fast as you possibly can, because at that stage of the game with the neurologics going on, that's where you're like a firecracker waiting to explode. So again, it's one of those things, we don't want to make light of any situation, but we always want to say, is it warranted to go and get the surgery, or is there breathing room where you can make an at least attempt for some relief work that can hopefully lead to something that is more corrective in nature, okay, and then from there stabilize it or support it with lifetime long-term wellness-oriented chiropractic care. For those people that are out there that think once you go to a chiropractor, you always have to go to a chiropractor. Well, I would love to say, yeah, I'd love you to do that. But we don't live in communist Russia. We do live in America where we do have freedom of choice, at least still yet. So again, we always present that we're going to start with a program of relief care. And we have a goal and a guide based on insurance standards and Medicare standards of what we hope to achieve within that first 4 to 6 to 8 weeks. If we achieve those, great. If not, we change our approach. And if we do and we get results, great. If we don't, Medicare guidelines allow us to change our approach 2 to 3 times before we say we're really not going to be able to help. And at that point, we have to make an appropriate referral. But as long as things are moving along, whether that's at the pace of a rabbit, a turtle, or a snail, okay, because as we get older, we change. I am 65. I no longer heal like a rabbit. I am healing like a turtle these days. And by the time I get to be my mom's age, in my upper 80s and 90s, I will be healing like a snail. And it's just a fact of life that affects, one, what can we anticipate, and how long do we anticipate that that might take? And if the answer comes down to months to years, well, work the process, because all processes require time. And you may want to get it done in 3 months, and what's there based on what are known as comorbidities and how those can multiply out care. You may be looking at years and you're thinking months. And when I'm telling you years and you're thinking it's just going to be months, Dr. Culbert's wrong. And then you're frustrated at 3 months where it still is going to take another 1.5 or 2 years to complete the process. You can't bail on it, because once you do, you start losing within 2 weeks all the benefits that you gained putting in the time. It's always great to talk to you in the office. It's great to share some extra time with you here before we go in and show them how we adjust you, which is very different from a lot of people. Some tidbits and takeaway from chiropractic and something that you can inspire people with.
It's not just chiropractic. So one of the reasons I didn't come, originally, way back when, is because I had that bad experience with chiropractic. So I fractured my neck. No, the MDs didn't do anything. They put a thing on my head and a net or collar for 6 months and physical therapy, and I had all this pain. And somebody said, go to a chiropractor. So they sent me to somebody. Whatever they were doing, it was bad. Because I would get in the car and I would be like a cartoon. I would see stars flying around. I'd be nauseous. And after a few of these treatments, I decided this is not for me. And I never went back. Then over time, so I was also a practicing podiatrist for 32 years. And there were chiropractors in the area. And there are 2 types of chiropractors. There's Dr. Jeff, and then there's the other chiropractors. And the other chiropractors are, I'm not going to use a bad word, but you walk in and I believe they believe that whatever money you have and any money you're going to make in the future, they now own. It's their money. So they're going to go in and they're going to have a special, they're going to have a nutritionist in there. They're going to have a neurologist come once a week. They're going to have a lab come in and take blood. They're going to do modalities, what we're called, that are not covered by insurance, that insurance doesn't pay for them because experiments or years of doing it, they found did nothing. But they promote it, they market it, and they sell it to you. And they're really looking for that group of people like me, who's looking for an answer from somebody because the MDs aren't helping them. And they migrate there and they just become these lifelong patients, and these people are making millions of dollars on these people. And that was another reason I didn't go to chiropractic, because I knew I didn't want to walk in and start getting inundated with, buy these vitamins. You need to have this done. It's not covered by insurance. It's only $3,000, but we'll give you a coupon book. You can pay it off every week. And I'm like, I don't want to do that. And I came here and the opposite was true. It was pure chiropractic with a health theory in the background saying, if you eat right, you do your exercises, you drink a lot of water, you come and see me every so often, we're going to do certain modalities to try to straighten basically my electrical system to make it function properly. And so far, so good. Everything's been good. So I highly recommend Dr. J. I've already had a bunch of people that I've recommended not only here, but 2 other chiropractors that are local to them, to give them a try. And one of my best friends who was in the same boat as me, didn't have surgery, had multiple injections, just keeps getting worse. And now he's going to a local chiropractor and he said the same thing. He goes, why didn't I just do this first? I feel so much better. I said, see, I told you so. Yeah, so I was a non-believer, but I'm a big believer now. And it actually does make sense. If you first you have to be injured, I guess, then to look back and go, boy, why did I do that? But yeah.
And sometimes, like we said before, hindsight is always 2020.
Yeah.
And Wayne brings up a really great point, because there are chiropractors that, again, don't necessarily reflect well on the profession.
Correct.
Just as there are MDs, DOs, podiatrists, physical therapists, massage therapists, there's good and bad in every profession.
Right.
The one thing that I have learned in my journey in chiropractic, and this is one of the reasons why we work so hard to give chiropractic as positive a light as I possibly can in what we do here in the office. One is, I do know for a fact, if somebody goes to see a bad MD, they will go find another MD, and they will keep searching for the right MD until they find the right MD.
Right.
Somebody has a bad experience with a chiropractor, that is typically it.
Right.
They will never go see and seek out a chiropractor who is one of those chiropractors who represents the profession well.
Right.
For whatever reason that is, I have no reason why to explain it.
Right.
But if somebody sees a bad chiropractor, they tell everybody never go see a chiropractor.
Right.
Okay. Wayne was in that experience,
right.
Hadn't seen it, and took the leap of faith and found a good chiropractor. So if you're out there and have experienced a bad adjustment or a bad chiropractic experience, keep looking, because there's more good people out there than there are, let's say, the bad people, okay, or the dark side of the force people. But keep looking. And one of the things that we do here at the practice, literally everybody becomes a member of our family. And I try to treat everybody like I would treat my mom, my brother, my father, in terms of the quality of the care that we give them at the office. It may be chaotic and crazy here at times, but for anybody who has ever read the story, Mike Mulligan and Marianne the Steam Shovel, okay. And if you've never read this book, guys, go out and get it and read it to your 5-year-old grandson or your 5-year-old son. But it's a story about a guy who has a steam shovel, and they just work better, and they work neater, and they work cleaner, and they work faster the more they've got to do. Because to me, it is an innate thing for me to be a chiropractor. God blessed me with the ability to be a good chiropractor. And the more people I'm serving, the better I get at it. You never want to come in on a day where there's 2 or 3 people around and I'm sitting around, just doing paperwork.
Right.
Because the innate ability or the healing within my hands takes a while to warm up and get going. I'm sure you found that when you were in practice. When you were busy, you were a better doctor than when you were less busy.
Right.
And the other thing is, we'll go over this with a patient during their initial visitor report of findings. I never want to waste 1 minute of your time, and I don't want to waste $1 more of your money than we need to spend.
Right.
Because time is money and money is time. Both are important. And they're important to different people for different reasons at different times. And I know in my office, and I know my mom and dad, my dad passed away last year, but mom still experiences with not so good doctors. An 88-year-old woman get taken advantage of. I don't appreciate. So when somebody's coming in, I try to picture them as my mom or dad, and I don't want to waste their time. I don't want to waste your money. I just want to get down to brass tacks. Let's get what needs to be done to bring down the level of inflammation, provide some relief, move into corrective care, and then I'd love to have everybody stay lifetime supportive wellness care, but that's not always everybody's
Right.
agenda. But if I approach it from the standpoint of, I will meet your needs where your needs need to be met, and if you have a great experience in my office, you'll come back and you refer others in. It paints a positive picture of chiropractic.
Right.
Okay. And in this office, every time we hire somebody new, everybody gets through the training of chiropractic's reputation is more important than our reputation. We do right by chiropractic and right by the patient. Our reputation grows. I don't have to worry about it. I'm totally convinced that universe will always reward services rendered. So I provide service. I don't worry about what the back end income is because I know it's going to be there because the power and the energy of the universe goes, you're serving, you're rewarded.
All right.
Okay. So I don't worry about that. That takes care of itself because of that innate universal concept. So Wayne, all I'm going to say is it was a great interview.
That's
I
good.
hope everybody out there in YouTube land gets a ton out of information out of just listening to Wayne speak, because he speaks volumes, okay, of what goes on when somebody has a little bit more of a complicated case. They're looking for help and guidance. And when they find it, it's like hitting that proverbial pot of gold at
Right.
the end of the rainbow.
Right.
So, Wayne, thank you so much for coming in. It was
Thank
a
you.
pleasure to interview
Thank
with
you.
you.
Thank
You
you.
guys hang in there because we're going to move on into room 2. We're going to get Wayne adjusted, and you're going to start to see how we do things a little similar to what we do with our normal patients and what gets done a little bit different and why. And we'll go over that when we do the video. But thanks for tuning in today. And again, if you saw anything that you liked from this video, please hit the like, the share, the subscribe, and the bell. Again, help our channel grow, reach more people, so that those people who have had a little bit of a negative experience with chiropractic maybe become inspired to, one, seek out a great chiropractor, incorporate the chiropractic lifestyle to everything that you're doing, and everything that you're doing will be augmented to a better new normal than it was without it. And you get to stay in control and work with your chiropractor as part of your healthcare team. And if that healthcare team includes a chiropractor, a physical therapist, massage therapist, acupuncturist, nutritionist, exercise trainer, you're creating your healthcare team. And the complete goal of the team is you and moving you to a better new version of yourself. So thanks for tuning in, smcc4u.com. We'd love to hear your comments. Visit the page. And if you're local to the area and you want to visit our office, we love showing it off. So you guys have a great day wherever you're at. Hopefully it's not raining like it is here in Hackettstown. And we'll see you in another video real soon. Thanks a lot, everybody. Have a great day.